2 years ago, at the age of 36, I never would have believed that I'd get the news that I have breast cancer. It wasn't until about 3 days later that I learned that I have something called triple-negative breast cancer. Today, I'll be talking briefly about what triple-negative breast cancer is, who gets it, what the treatment is, and some preventative measures that we can take as women. All the information today is taken from thebreastcancer.org, CDC, and the Triple-Negative Breast Cancer Foundation. So what is triple-negative breast cancer? It is a fast-growing, it's very aggressive, the aggressive of all breast cancers, has a poor prognosis, and has a high rate of reoccurrence. It is 10 to 20% of all breast cancers. It is found in men, but mostly in women. Not much information is about men. It is also the least studied of all the types of breast cancer. So what makes it triple-negative breast cancer? Well, most breast cancers either have high levels of estrogen, testosterone, or the HER2 protein, or they have a high level of all three. Triple negative is difficult because it has negative for all of those, hence the name. So now we know slightly what triple-negative breast cancer is. Who gets it? Well, normally when you hear breast cancer, you think of older women, especially those over 40. Well, with triple-negative breast cancer, younger premenopausal women typically get it, sometimes even as young as 20. African Americans also have a higher rate of getting triple-negative breast cancer. But also, if you have a mutation on the BRCA1 gene, otherwise known as the breast cancer gene. And in my case, I was premenopausal, and I also have the mutation in the BRCA1 gene. So you might be thinking, well, how do you treat breast cancer then? Especially since it's so aggressive. Typically, triple-negative breast cancer has 3 modes of treatment: chemo, surgery, and radiation. Now, sometimes chemotherapy is first, sometimes surgery is first. It really depends on your doctor and the size of your tumor. In my case, my tumor was quite large, so I did chemotherapy first. Then I had surgery. Now surgery, you can either have part of your breast removed, 1 breast removed, or 2 breasts removed. Radiation is done to get all rogue cells that might be left in your breast or any parts of your body. So this all seems really kind of scary, especially since it's so aggressive. But is there a way to help with early detection? There actually is. For women out there, please do self-examinations. If you don't know how, please look it up. It is the best way to help prevent yourself from getting further along in your disease. Also, knowing your family history is very important. Also, genetic testing can be done. I did genetic testing after I realized I had triple-negative breast cancer because it is really prone in families. This is really positive because now my family, including my sister, can get early testing done, including mammograms. Also, mammograms are really important, so women, if you're over the age of 40, or even if you can get them earlier, when knowing family history, please get them. Well, I could talk a lot more about triple-negative breast cancer and my personal experience, but I only have limited time. So let's recap what we learned today. We learned about triple-negative breast cancer is a really fast, aggressive breast cancer. Typical women that get it, such as young women or African Americans, there is treatment such as chemo, radiation, and surgery. And you can also try to prevent it by knowing your family history and genetic testing. Thank you.